And welcome back to Movie Conversations. I'm Brian Ritchie. Joining me as always is Nora St. John. Good morning, Nora. How are you doing?
I'm doing great. I just got back from about a 3-week trip in France where I walked and biked and walked and biked and ate a little more than one usually does because it's France. But I'm
As
doing
you
great.
do.
As you
As you
do,
do.
because why not? Like if you don't, you're kind of an idiot.
Exactly. No, it feels odd. It's been like 3 weeks since we recorded, so it's almost one of these things like, all right, getting back on the bike, getting back on the horse. Okay,
Yeah.
we're gonna start this back up again. Fortunately, we got so far ahead, but now, this episode is gonna release in a couple of weeks, and we have something that's going to be happening at the end of the summer that we need to make an announcement on. I'll let you do that.
So Brian and I have been talking since we started these podcasts about doing some in-person workshops, and that's something we've always wanted to do. It's been on our goal list, and we're going to be doing our very first Moving Conversations live in-person workshops at Blue Moon Pilates in Orange County, so Southern California. And those dates are going to be September 13th and 14th. And we're going to do a full day on low back pain and then 2 half days, one on osteoporosis, very hot topic of the moment.
Yeah.
And also another 3 hours on the shoulder. So you can find that registration at Blue Moon Pilates. I think it's bluemoonpilates.com under their workshop page. We'll also put a link in the show notes. And we would love to see some of you guys in person and be able to work with you in real life. It'd be really super fun. So come on and join us and learn a few things.
Yeah. Just keep in mind that when you're listening to this in the car, you're only getting half of what we're really doing, because a lot of times when we talk through exercises, we can put a little bit on Instagram, we can put some on the YouTube channel, but it's not like in person where we can create new exercises where we're going through everything and you're going to get the practical application a lot more than just the theoretical. We try and get into as much of the practical as possible through an auditory sense. I mean, you can only listen to us and watch us a little bit, but this is really the practical side where you can actually jump in and play. And something that Nora and I do a lot is we create exercises on the spot based on questions that come out. It's like, oh, have you tried this? And modifying things, and all those modifications. A lot of times it's just us playing in the moment and creating new things. So I got to tell you, I think we've taught courses, either together or separately, where you teach it one time, it's great. You teach it again, it's different. You teach it again, it's different, because the people in front of you are different and the questions that come up are different. So this is a great opportunity for you to get the practical application and be part of the learning process and actually some of the creation process as well. So yeah, this is going to be a lot of fun. I'm looking forward to it.
Yeah, come on and join us September 13th and 14th in Southern California, in Mission Viejo, in Southern California, Orange County. So we'd love to see you there. And plus you get a little beach time. It is September. It should be beautiful. There shouldn't be any fog. So come on down.
Awesome. And as always, do us a favor, hit that like and subscribe button, comment, share, do all those fun things. Yep. So do all of that. Hit us up at Instagram. You can always DM us there at Moving Combos. You can also do it movingcombos@gmail.com. We're getting more and more emails coming in with people telling us what they're doing with different exercises and different concepts. The osteoporosis one, I got to tell you, was off the hook. Everybody loved that. So I think that's going to be something that we're going to revisit in greater long form down the road, because that was one that we just decided one day, hey, I think this is a good topic for us. We sort of mentioned it last week. Let's talk about it this week. And we have gotten so much feedback on it. That's like, look, maybe later on down the road this summer, let's do a deep dive into osteoporosis, because I think that's a hot topic that most of us either work with clients on or may have the issue yourself. And we're going to see a lot more of that. Also, tying into that, what people don't realize is that with GLP-1s coming out now and things like that, people are losing so much weight and not doing enough exercise that we're actually seeing people's T-scores. They're getting more osteopenic and osteoporotic as they're losing weight. So it's just something to keep in mind. We need a lot of weight-bearing stuff with those clients. So you may start seeing more of that as clients come to you after they've lost a lot of weight. So just something to keep in mind. Calcium deficiency, all of that from severe weight loss is very common. So these are just things to sort of keep in mind in the future that we didn't have to 5 years ago, but now it may be a little bit more prevalent. So I think osteoporosis is definitely a hot topic.
Awesome. All right. So speaking of osteoporosis, we wanted to do just a kind of a deep dive case study.
Yep.
And Brian's going to bring up a client, multi-diagnostic, if you will, many different autoimmune conditions. And this is to Brian's point. Brian said, like, the theme of today is patience. Right. That
Yes.
sometimes you just got to move really slow and you will get there, but sometimes it takes a lot longer than clients expect, or than maybe you are used to with clients that are, don't have a lot of things going on. So we just want to kind
Yeah.
of talk through a complicated case study with you guys and see if we can help you understand some of your complicated case studies as well.
Yeah. Keep in mind that we're in a society where we thrive on instant gratification. I mean,
Yes, we are.
it's
We do.
just
It's how it
I
is.
I go with this with my kids. They have on demand. They watch whatever they want whenever they want to. They can do whatever they want. Pretty much everything's at their fingertips. Whereas,
Yeah.
when you and I were kids, you had 3 channels. And, if the president was talking on TV, well, your night was screwed because everything shut off. I mean, it's just one of those things that you just don't think about now because there's so many choices out there. And
Yeah.
people are used to that, getting what they want, getting that fix immediately. And when you see shows like The Biggest Loser or any of those type of shows on television that see these drastic weight changes or drastic body changes in such a short period of time, they sort of expect that, well, this shouldn't take that long. Why should it take, a long period of time, without realizing that, look, everybody's body is different and not everybody can live doing exercise, 24/7, which a lot of those situations are. So
Yeah.
patience, I think, is a theme that is very important. And with this client, uh, let me just, I'm going to give you the brief history. We're going to call her Miss B. Okay.
Okay. Miss B.
Miss B. I'm trying to look at her age real quick. I think she was 46 when she first started with me. So 45, 46-year-old female came in, and I'm going to just go over a few of the things that she's got going. Okay. The first few are going to seem like, oh, okay, that makes a lot of sense. That's normal, especially around here in Washington, D.C. We get a lot. Neck pain, a little bit of cervical strain. Anytime exercise seems to flare that up, sort of chronic neck pain. She's had multiple ankle sprains, some low back pain, normal wear and tear on the body.
Musculoskeletal stuff.
Yeah,
Right, which
most
we
of
work
us,
with all the time. These are kind of common musculoskeletal stuff.
if it was just that, it'd be like, okay, normal for what I do and what I see. Broken feet. She had CRPS, complex regional pain syndrome, with one of her when one of her feet were broken, that sent her into a spiral like you wouldn't believe. And then after that, sort of everything started to come out. She was diagnosed with polyovarian cystic syndrome. She also has dysautonomia, which is a neurologic issue. So there's a lot of underlying things that sort of came about after her foot started. I mean, when we talk about pain, we're talking about such extreme pain. She couldn't walk, she couldn't move, she couldn't put any weight on her foot. And that sort of started the downward spiral. Diagnosed with chronic fatigue syndrome as well. She's also got POTS. So she has very low blood pressure that just drops. So we're talking about a lot of things that she has that may not be something that you're going to be that familiar with coming into your practice, especially someone who has such a multi-layered, it's not just one of these things, but it's all of these things.
So, Brian, let's unpack that a little bit. That's a lot of
Yep.
3-letter
That's why I
acronyms. TLAs, as
some
my
things.
husband used to say.
Yep.
So complex regional pain syndrome, right? My understanding of that is it happens occasionally after something like, typically, I've always seen it in the lower limb, in the leg, foot, and ankle.
Yeah.
Typically. And then it basically is like a chronic inflammation that gets into the nerves, gets into the whole system, and creates really unbearable pain. They used to call it, I think another name that I heard was like tarsal tunnel syndrome.
Oh, yeah. Yeah. Okay.
So they've had some different names for it over the time. And it is a kind of chronic pain that is really difficult to manage. And
Yeah.
and again, like the foot is essentially disabling.
Yeah, just think if your nervous system's always on fire. So anybody who's had shingles or anything where the
Yeah.
nervous system is sort of always on hyperactive, there's constant burning. She couldn't, like I say, any pressure on the foot would immediately flare it up. There's sensitivity to touch, sensitivity, a lot of swelling, a lot of stiffness. So there was a lot of that going on, and that took her a number of years to actually solve the problem. It wasn't just, waiting for the toe or the foot to heal. It was what came after it. And that's what she was dealing with for a number of years.
So this is a situation where, like, we talk about this a lot when we talk about chronic pain of different kinds, right? There was the injury,
Yeah.
but trust me, within not that long a period of time, that injury has healed. If there's a bone fracture, the bone break, like that has healed.
Yep.
But it is this secondary cascade of chronic pain symptoms that become the problem, and those really are neurological and brain chemistry related, as
Yep.
opposed to being really purely physiologically, musculoskeletally related.
Yeah. It's one thing if it's just a tendonitis or something like that, or a bone break. We've all
Mhm.
had issues with that, and those things heal. But when they get into the nervous system, when they get into the autonomic nervous system, that really sets everything sort of alight. That changes everything. And her life literally changed on a dime when this happened.
Yeah.
Uh, Now, I'm also going to say high stress job at the time. High stress job, and also other things that led to additional stresses. So there was a lot to unpack with just that aspect that goes way beyond our scope of practice. That's nothing that we can deal with. She's dealing with other things for that. Totally cool. But we saw that, when the more I got to know her, the more some of those things started coming out. And it was like, okay, this all sort of made sense, especially with the chronic fatigue. There's something that I was thinking is, could there be some fibromyalgic like symptoms? There's other things that were sort of jumping out at me with this client that were making me think, I think there's a little bit more. I think the dysautonomia was the big one. And that tied into the chronic fatigue.
So dysautonomia, autonomia relates to the autonomic nervous system,
Yep.
which relates to blood pressure, regulates a lot of breathing rhythm, all kinds of things in our body. So it's the autonomic nervous system is kind of the automatic processes that occur physiologically to keep us going. I think if that
Mhm.
makes sense. So when it goes wacky, it has effects on blood pressure. It has effects on cardiac rhythm. It has effects on how the organs function.
Yep.
And it has many different, if you look it up, it's like this is a mystery, kind of a mystery thing. It has lots of ways of manifesting itself. It has lots of different symptoms, and they really have, from my understanding, not a lot that they know what to do with about it. It really is that the autonomic nervous system loses its mind a bit, and then we have to figure out how to work with that. And related to that is the other acronym, which is POTS, postural orthostatic tachycardia syndrome,
Mhm.
which is a specific kind of dysautonomia, which means that the blood pressure is not well regulated.
Yep.
So, and the typical symptom of that is when somebody goes from, let's say, supine to seated, they get very dizzy. Their blood pressure drops dramatically. Their heart rate may go up a whole lot, like different things can happen, and they get dizzy and they can fall over. So, POTS is something also has become much more common after COVID for some of your clients who have had COVID or
Yeah.
long COVID symptoms. So that's another thing just to think about.
Yeah. And part of that too, with the dysautonomia came the chronic fatigue as well. And
Mm.
when it hits, the best way that I could describe it is when I was speaking with her about this, it's as if her hard drive just gets messed up.
Mm.
You know how our bodies do our normal everyday things all the
They do
time.
their things. Yeah.
And all of a sudden, nothing's working. Nothing is working. It's like the computer doesn't want to work inside of her system. So nothing is regulated right. I will say this when you come to the tachycardia, it is ridiculous where her heart rate is during exercise. Sometimes she's not exercising at all. She's just sitting there and it's at 125 to 130 beats a minute.
Yeah.
And it'll stay that way for 4 hours.
Jeez.
It won't come down.
Which
And she
wears you
said,
out.
well, that's just it. She'll send me, fortunately nowadays we have a lot of ways to, like, my Apple Watch and all these things that we can gather information. So I get to see all of this in real time, which is neat, but there's not a whole lot we can do about it because it can't be regulated simply through exercise. So again, this is one of those things as well, where you have to really take the person each time they come in as a brand new case almost, because you don't know what body's going to be in front of you. And I may have 5 great sessions where they're exactly the same. And then the next one, I'm seeing a totally different body in front of me. The body's not doing what I think it should. And what my brain is saying, but it's supposed to do this, and it doesn't. So that's where that patience really is something that needs to come out in us. And we're going to go into greater detail as we go. But when you're working with a client who has something wrong with their neurologic system, that can be really a big challenge.
I think it's in my clients I can think of where that's the situation. It's been the most challenging thing to work on for me personally, personally, professionally, and psychologically for me, because I really can't count on any of my usual tools to be effective. And I'm not even going to say every time, but most times.
Mm-hmm.
You know, it's like some of it is, I find the first thing is creating trust and helping them to just down-regulate their sympathetic nervous system, bring up their parasympathetic nervous system, which is basically just creating a safe environment, you know, using a calm voice, not too much excitement in the room. I mean, just helping them to breathe, like all those things at least can help. They're not the solution. Don't get me wrong on that, but they at least allow the client to just get out of kind of a state of really chronic anxiety and stress, which those situations often cause, and start to make just some progress in terms of how they can moderate their nervous system as best they can, which varies wildly.
Yeah. And I want to explain how normally when clients come to me with whatever they have, there's sort of a foundation that you have to build up. You have to get them to the point where they can exercise.
Yeah.
Well, that foundation I used to think was the basement. Now I realize there's a sub basement and a sub basement, and we're talking like -10 for certain clients. And this was one of the first people that made me realize that I thought, wow, okay. So something that I think is very simple, like just lying there, lying down and doing something like a marching or lifting one arm, she couldn't do sometimes. And sometimes she'd lift one leg, no problem. And the other leg would jitter and shake, or you could see she's trying. Her brain is trying to lift the leg, but nothing's happening. You could see it. It's trembling and she's trying and she's trying. I'm like, I watched her walk in. There's not as though I'm dealing with someone who has severed their spinal cord. This is literally her telling her body what to do, and it's not responding. And so just to teach a simple marching, just to see if I can get her to move right, I literally had to de-weight her legs to almost nothing using the springs on the trap table, where I just literally said, okay, I'm going to make these things weigh a feather, just so I could see neurologically if the weight of the legs was the issue or if it was the movement. And the more I lightened her, the more she thought, oh, it floated up. And I started working on different ways to cue, different imagery, where I'd say, I want your leg just to float, not lift. I didn't want to have something that hard of a phrase. Just let it float up. And as soon as I said that, it moved. And it was able to work. And I'm thinking, okay, there's something going on with what's coming out of my mouth, how it's being processed, and how her brain is processing that information. So it was literally going into that sub-basement level for a while to get her body to respond the way that I thought it possibly should. And I found that getting her to breathe, just putting her on, something like the half a foam roller, just so she could feel a little opening. She loved the feeling of it, one of the super soft ones, just so she could feel a little opening of the chest, put her arms out. I said, no, just breathe. Let's focus on different, width of breath and length of, all these things. And just that would take us 15 to 20 minutes of getting her immune system to parasympathetic, just to get her to relax. And then, okay, just lift an arm, let it float up and then down. And it took us probably, I don't know, 6 to 8 weeks of doing that. Any type of physical therapy that she'd been to before, personal trainers, she's someone who wants to work hard. She really enjoys that. But everybody pushes her too fast and too hard. So she always has a flare up that when I say sets her back, she's in bed for a week, sometimes longer. She can't literally get out of bed and she works. So she has to. And so it's not as though she could say, oh, I'm a person of leisure that can stay in bed for 2 weeks. So it was, okay, we need to find where your level is today and do micro, we're not going to take a step of an inch. We're going to take a step of a millimeter each session. And during the first couple sessions, I literally told her, I am here as long as you are. If this takes us 5 years to accomplish what some people might do in 5 weeks or 5 months, that's okay. I'm here. And we're going to take small baby steps each week. And one thing that I told her is I said, look, life is a cha-cha. And she looked at me and I said, 2 steps forward, 1 step back, 2 steps forward, 1 step back. And she loved that. And she said, that's my mantra. She said, because she does that. She'll make some progress and then she'll get back a little. Then she'll make some progress and she'll go back a little. But I say, look, where you were, and I've been working with her for a number of years, 2022. So it's been 3 years. She's come a long, long way. And she's able to do regular things like lunges and all this kind of stuff that she's able to come a long way. But it took us a year of supine mat work, of her barely doing anything. And she did her homework on a regular basis. But again, slow, steady, 1 inch at a time, 1 millimeter at a time sometimes. I mean, the first session was just having her sit and using a soft melt ball, those real soft balls for the feet, and just do positional point pressing on her foot a little bit. Because she said, oh, this feels good. Massage hurt too much, but she could do it to herself. And then she said, I actually can feel my feet now. I'm like, all right, we're waking some stuff up. So, and I know I just threw a lot at you, but it's really trying to get part of her immune system, part of that regulatory system to calm down, part of that nervous system to just take a breath and allow her to relax, get that stress level down so she wasn't on heightened alert all the time.
So we talk about the nervous system as having, right, the parasympathetic, which is rest and digest, and the sympathetic, which is fight, flight, freeze. And it sounds like to me, just from the outside, and again, I'm kind of being like the outside view on here, or the interpreter of what Brian was doing for you guys, is you were essentially down regulating the sympathetic nervous system, which is extremely hyperactive for her. Yep. And with chronic CRPS, that's a really common situation, is that the sympathetic nervous system is overactive. That essentially, with a lot of chronic pain, the body's going, oh my God, 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 all the time. And that causes the nervous system to get it. That's the sympathetic nervous system active, going, oh my God, I'm in danger. Yep. That's what the sympathetic nervous system does. And so both with your words, the way you talked about things like float rather than lift, breathing, feeling what feels good, helping her to get into her physical presence in the moment, as opposed to performing something like, doing 10 of this or 6 of those, or moving this or that way. I feel like that's where you were able to, again, get her into her parasympathetic state, and then she could move from there. And that's where, if I just think about physical activity, right? For most of us, physical activity involves a certain amount of a sympathetic nervous response. And if you think about a high-level athlete, it absolutely does. There's a way in which the stress, like the competitive feeling that like, I got to get there, I'm going to like beat, whatever it is, I'm going to crush this thing. That's all sympathetic nervous system. Right? Would you agree? And there's a way, right? And there's a way in which a lot of physical training particularly, I wouldn't even say nowadays, just that there is a lot of it that comes from that perspective. Like you can do more, push, push, push. That sympathetic nervous system reacting and activating. And what you were really doing with that whole first year, it sounds like,
Mhm.
was just getting that down regulated. And it sounds like that was probably being being upregulated in her regular life, in her job, and other activities. So that's just something to think about, is like creating that level of presence for the person, parasympathetic nervous system activation, that calms down both the nervous system and also does good things to the immune system, by the way,
Yep.
also. So kind of can calm down both of those situations.
Something that I didn't mention, when she would come in, she was also hypersensitive to noise,
Yeah.
to
Yeah.
light. So I have a secondary room, my Pilates room. I've got a weight room and I've got a Pilates room. We'd go in the Pilates room, we'd close the door, and I'd turn off the lights.
Yep.
And we'd literally just have one small light, like from a closet, where I just let a little light sink in so I can still see the person, because obviously I need to see them.
Right.
But I needed to take away all distraction, all stress, because even closing your eyes in a lit room, there was still some stress. So I literally had to eliminate as much stress as humanly possible, as much information to her brain as physically as much as I could, to get her into her body and to allow her to get into her body in a safe way.
Right.
Because unfortunately, when you're dealing with pain all the time, there's a lot of that, like you say, fight or flight. It's always, I'm going to conquer this. I'm going to beat this. And it wasn't until we changed the language. And I've said this many times, sometimes you have to name your pain, like an uncle that you don't like, that they're coming to visit. That way you can almost dissociate it and put it on the shelf. So I'd say, hey, he's in town today. He'll be gone later. Don't worry. And
Right.
when I did that, she
Exactly.
was able to dissociate. And she thought, oh, okay. So there was some of that as well, mental stuff, that some of it you're just creating on the spot just to get her system to calm itself down. But literally, I had to put her in a very safe place where
Yeah.
she felt she wasn't going to hurt herself, that she wasn't going to get hurt by me.
Yes. She was in control. That's the other
She
thing
was
about
in
chronic pain is you put her in the driver's seat as much as you possibly could.
100%, and a lot of release work to start with. The softest foam roller, just lay on it,
Mhm.
put your legs on it, and just move to side. Just, what does that feel like? And I mean, a lot of it was just that, and it's making it up as I go, because I'm thinking, okay, I do need to get her to feel her body. I need her move. Okay, if I can have her just roll a little bit, if I can just have her push down on the foam roller, if I can have her lay on the foam roller, then I got her on a full foam roller and she had some instability. So I'm like, okay, she's got some core work going on, whether she likes it or not.
Yes.
And
Mhm.
and then she's comfortable. Okay, so snow angels, getting a band and maybe pulling slightly apart just a little bit, the lightest band humanly possible. I mean, it was like a rubber band. It was so light. But just getting her to move a little bit and moving her body through space, arm scissors and circles, and things that you would think I'd be doing with a 90-year-old. But literally for her system, she needed that. And we would make a lot of progress, and then she'd sort of freeze there for a while, and we couldn't go beyond because it would set her back. And then we'd put a little bit more and a little bit more. And like I said, she wants to work hard. So she would be like, I'm ready. I'm ready. I'm like, okay, one new exercise. Let's see how your body responds. Again, one variable, that's it. So every exercise is about the same. So I introduced her to the reformer, just footwork. That's it. And she loved the footwork. She, oh my gosh, this feels so good. And again, slight step back, but then she started making progress. Okay, let's try feet and stretch. I mean, I was trying anything in the lightest way possible, but her body started to respond. And like I said, then getting her up off the floor, lunges, basically up, up, down, down, getting up off the floor, teaching her how to do that properly, and squatting, sitting, getting up and down out of a chair, simple things. And how I always reset it was, your body already knows how to do this. She was like, oh yeah. I
Yeah.
said, just sit down. Now stand up.
Right. Right.
It's nothing that I'm teaching you. And then, okay, let's add the squat. Then let's add this, let's add that. Small things each time. But again, I have to give her all the credit in the world because she allowed me to take that time and to
Mhm.
have that patience. And she has thanked me more times than I can count for having that patience with her, because so many times she's gone to a PT or a trainer or has wanted to do something because she's heard about it. And it's like, oh, I got to try this new thing. And it's like, okay, fine. I understand where you're coming from because I have that mentality. But I think, especially with our type A clients who want to go, 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 their daily life has that intensity already there. So their sympathetic nervous system is already from a point of 0 up to like a 3 or 4 regularly. And I found this to be true. I don't know if it happened in California, but it happened here during the pandemic. Everybody's state went
Mhm.
to like an 8, 9 for a little bit. And then
Absolutely.
and then afterwards it came down to like a 5 and hasn't
Yeah.
budged. And I think now things are starting to calm down over the last year, but for a while it didn't go back to a 1 or a 2.
No.
And now, unfortunately, being here in Washington, DC, the stress level in this area is really high right now. So I'm seeing a lot of
Mm.
clients whose sympathetic system is already higher because of that.
Yep.
So there's a lot of stress in the air, just in the area. And if you're working with clients who are that go get them and high intensity type of person who really want to, high achievers, you got to be able to regulate that sometimes because they can go too far and they're not going to see the gains that they may want to because their body doesn't get that recovery time. They get part of it, but they're still at that heightened state a lot.
So in your case, like this is not that uncommon. I don't know about you guys, but I worked with clients like this regularly. Maybe not quite as severe as Brian's, but the pieces that he's bringing out are really, really key. And it's one of the things that I find in our environment, in Pilates environment, and in Brian's version of the personal training environment. Like, this is about patience for you. Okay, so that's the other thing is I can't tell you how many young instructors that I've worked with who get frustrated when their clients don't
Mhm.
progress. Like, they feel like, oh, that client should be progressing. Why aren't they progressing? When you've got a client like this, like, a lot of it is you have to let go of feeling like your sense of self-worth is moving that client forward.
Yes.
Your sense of self-worth has to come from them making those tiny steps. And it is very much cha-cha, or it's very much chutes and ladders, right? They're working pretty good. They're working pretty good. And then something happens, and it can be, for one of my clients, it's like they were in the middle of a divorce or their kids were having some issues. So their stress level in their regular life or their work life goes up.
Mhm.
And then that would often cause them to have a flare up or at least not make progress for a while. It's nothing to do with you. This isn't about you. This is just about their nervous system not able to cope with what's happening for them. So I
It's
think that's
something
just an
also,
important way to think about it.
I think, for us as, people who work with the body workers in general, we tend to take on the responsibility of the client.
Yes, we do.
And even our richest client who wants to see us as much as possible, we're talking 3 to 5 times a week. And I'm saying that's the super rarity. Most of the time it's once or twice a week. What is there? 168 hours during the week. Okay. They're
A little
awake
bit.
during at least more than they're awake 120 of that or something. Well, guess what? They're seeing you one. It's what they do
Yeah,
in the
exactly.
other
It's
hours
the rest of the time.
that will hinder sometimes the progress that we think that they should be making,
Yeah.
because they're not making whatever gains that we're thinking. Wonder why? Well, guess what? Their stress level went up. Something happened at work, something happened to the kids, or they just fell off the wagon a little bit with their eating regiment or something, and they're feeling guilty about that. So they're not eating the most nutritious food, or they're traveling more. So they're eating junk on the road, or their alcohol intake goes up. There's too many variables in daily life. And we talked about this last year, this time, when people start gardening. So suddenly they're in the
Right,
garden
right.
and
Yep.
they're squatting,
Leaning
twisting,
over.
turning. Yeah.
Yep.
And they come in and their back is hurting, and human nature, they want to blame something. And sometimes they're like, well, the last time we worked out, my back has been hurting me ever since. And I start feeling responsible, thinking, man, we've been doing the same
What would
ish
we do? I
stuff.
don't think we did
What did
anything
we
different. Yeah.
Yeah, what did we do that would have flared this up? And it's not until you
Right.
talk with them where they explain, well, on Saturday, and I said, when did it start? They said, well, Sunday. I was like, well, I saw you Wednesday. I don't
Right.
think
That's not likely to be me.
I don't think it was what we did, but I'm also not going to tell them they're full of it. I'm going to politely say, well, that seems like a long time after to have something flare up. Let's see what else might have happened. Oh, Saturday you spent 8 hours in the garden. I wonder, and usually that wakes them up, say, oh yeah, that's probably what it was. I say, yeah, that's probably a contributing factor at least. So, don't make them wrong, but maybe wake them up a little bit. But we all go through that. We all have those issues. So we can't take that responsibility on ourselves all the time. And in us having that patience to really work with these clients who have these other issues, or the ones that I call peeling the onion,
Mm-hmm.
where they come into you and they have one issue. That's their primary thing. And they may mention 3 or 4 other things going on, but they mention it's my low back. Cool. And we start doing that. Then all of a sudden, their back's feeling good. My knee's bothering me. Okay, well, we're going to focus on that. Then their back flares up again. Okay, so it's whack-a-mole. You're whacking that one down. Then you deal with the knee. Then their shoulder, and they're like, "Well, I didn't know." And I'm thinking, look, just because they weren't all talking loud doesn't mean that everything that you've done up until this point hasn't contributed to all of these things flaring up. It's just the loudest person in the room gets the attention. So your back was the loudest.
Absolutely.
It
Yep.
calmed down. Now your knee's loud. It calms
Yep.
down. Then your shoulder, your neck, whatever it is. So I say it's peeling an onion. It's like, okay, one more layer. And it is whack-a-mole. You're hitting one and then suddenly the other one pops back. You're dang it, hit that one back down again. And you have to have that patience when they come in to be able to, and I've said this many times on this, where I have the perfect workout. It's going to be kick butt today. They're going to have so much fun. They walk in and say, I did this, and I'm just crumble it up, throw it in the trash. Okay, let's deal with what I see in front of me, obviously.
Redirect. Time to redirect.
Exactly.
Figure out something else.
Exactly. And for these clients who require a little bit more patience on our part, because we also have to remind ourselves that it's not our goals, but their goals that are important.
Exactly.
And just because you're bored or you don't want to do that same exercise with this person, or if I do pelvic tilts with this person one more time, I'm going to shoot myself. But guess what? Maybe that's the perfect exercise for them. So it's not what I need. It's what they need. And if they need me to go a little slower and to get them to calm down and have a session be almost 50% talking and 50% movement, maybe that's what they need today. And maybe next time we'll push a little harder. You really got to gauge the person in the room.
It's also sometimes, like, I'm thinking about a couple of clients here. I remember one client that I had who basically had degenerative disc disease at several levels. She'd never had a fusion. She was in severe chronic pain most of the time. And she was an upholsterer. So, she was dealing with like giant, and we're not talking like small stuff. She would make, 20-foot long curtains and things like that for fancy homes. So she was dealing with like weird, heavy, big objects she had to manipulate a lot.
Oh my.
Yeah. And there was also some drug abuse in that process, just because she'd been addicted to painkillers for reasons you can imagine. And so it's really interesting with her, because with her, like, we kind of weaned her off the painkillers, at least got her to a very moderate dose on that. So she wasn't abusing them, essentially, with the help of her doctor. That was not us. That was like working with her doctors. But basically in her case, when she came in, this was maintenance for her. If she could come in twice a week, do essentially exactly the same program pretty much every week, that kept her functional enough to do her job, to make a living, to keep her life working.
Yep.
And again, that's not where you hope for your clients. Like, you hope that you can heal them 100% and make them better and, make like them all perfect again, but you can't always. And in her case, like, the most valuable thing was that she could come in twice a week, do exactly the same program, and then she could continue to work as much as she needed to make a living. So again, sometimes you're really working on progress. Sometimes you're working on finding a maintenance routine that really works for that client.
And with that maintenance routine, I don't know if you've gone through this, but I've had a number of clients that when we find, I call it their combination. It's like
Yeah,
their combination
exactly.
lock. You get in their brain and
Yep.
you're trying to figure out their combination for their body and their brain and everything that's going on. You're like, you got it. Okay, if I hit that combination just right, their body works great. They can do whatever they need to do. They're
They don't
functional.
flare up.
They don't
Mm-hmm.
flare up. They're a great parent. They're a great, everything
Yep.
that they need to do on a regular basis is great. Okay, we're going to stay that way for the next 6 weeks. Then I might introduce one small thing or a variation on the same exercise.
Yes.
I'm just going to throw squats out there. Let's say they're doing squats, and I might say, okay, now when you stand up, I just want you to stand up and now take a step to the side a little bit, and now do a squat.
Uh-huh.
Maybe take a
Right.
step to the side. And I'm talking about, for a lot of people, that's so simple. That's nothing.
A micro step, but a step and a
Micro
very
progression.
Yep.
Exactly. And then that's like, oh, that worked. Great. So then that might become the exercise for 2 or 3 weeks. And it's frustrating. Yes, it's frustrating. But again, you're not changing that combination a lot, but you're changing it enough that they're going to make those progressions over time. But I got to tell
Yes.
you, those clients, if they have the patience with you 6 months, a year down the line, we've made big progress. And now they're able to do things. A client that just walked out of here, I just worked with her. She actually today, she wanted to, this is someone who I've been working with for many, many, many years. And she's gotten very strong. When she first came to me, doing anything more than like 10 pounds, 20 pounds in like a row or a pull down was going to be a lot. And she's doing 145 pounds and doing it for 12 to 15 repetitions. But it's taken
Wow.
years. And I have a special machine here where the poles are different colors, and she's been using a heavy one for a while. And she goes, one of these days, I want to use that blue one. That's the next level up. And I'm like, that's my male clients have a hard time with that one. That's like more my weight. But I was like, I said, I'm going to find an exercise that she can use it. So I said,
Yeah.
here, just
Yeah.
try this. And she was already tired and fatigued and thought, I don't know. But I said, you've done this exercise 100 times before. Just try it. And she did it. Her eyes got big. She goes, oh, and you could just see in her that how much progress she's made and how good she felt. And I said, remember, you used the purple ones, which are like 3 pounds. And that's 75 pounds that you just pushed. She goes, I can't. And you could just see in her eyes the pride that
Yeah,
she's.
absolutely. Success. Yeah.
But again, do we still do some of the same exercises every single time because it's her combination to her lock? Yes. But a couple of the things, I'll make those micro changes, and it makes her feel good. And over time, we've been able to increase and get her a whole lot stronger. And it helps everything from her self-confidence to the way she moves, to her back pain, to her knee pain, everything. So again, it's about finding what's working, making the small progressions, and allowing them to have the patience with you on, we're not going to push too far, too fast. We're going to take our time. So that's
Yep.
just to think about with some
No,
clients.
exactly. I mean, I had a client who had kind of arthritis everywhere. I mean, she had arthritis in her feet, she had arthritis in her back, she had arthritis in her shoulders, her hips, like everything. She just had a general overall inflammatory situation going on for a long time. She was very short. She was maybe 5 feet, And her husband's favorite thing was to do kind of exotic travel. And so this client's goal was, I need to be able to step up into a bus because she was really, really short, right? Without everything hurting. And she was a classic case of, we started really small with a little bit of this, a little bit of that. This was primarily a Pilates client. And then we finally got a routine that basically allowed her to do what she needed to do. Like, she would do the whole program. She came in, we did basically the program. One of the key things we worked on, this is specific to the reformer environment, was a chair step up or a single leg leg pumps, right? Where she would stand, put one foot on the pedal, one foot on the seat, and use the weight of the chair to lift her up and bring her down, like she's going into a bus. Basically, we got very practical what's going on here, and with her, it was like she hated that every time. It's like she really would. She's like, "Oh, we have to do that stupid chair exercise." I mean, she would really just go off. Like, I hate that chair exercise. And I said, Carol, just think about the bus. Just think about the bus. She's like, okay. And,
Yep.
that was something where we would slowly decrease the help she was getting. Like at first it was, I think, 2 heavy springs on the top, and she wasn't that big a person. They were like launch her into space essentially, and then we would just slowly decrease that. And she wouldn't know it. Like I wouldn't really tell her. I would just take it down like 1 notch, and then we'd work for a while and then take it down another notch. And she was a client though, where if we went off the reservation in any way, she would flare up. And again, those flare-ups could last for a week. It could last for 2 weeks. It could really take her back. So once we got a routine, it was like, this is, like you said, this is your combination. Like, this is what works for you. And we had both a routine event and also a home program. Very simple, like 4 or 5 exercises. But if she did those 4 or 5 exercises, she could get out of bed in the morning. She didn't have a lot of pain, and she could do what she needed to do. So it's the same thing. It's like we just developed the program that worked. And when I would go on vacation, like her chart said, don't change anything. Like, do this program, right?
Yeah.
I'd be very clear with whoever was taking over while I was gone, because I knew that would work. It's like, don't worry about it. Don't feel like she's going to be bored. Just do this program.
I'm glad I'm not the only one who does that. I do the same thing.
No, I mean, every now and then it's like you've got those clients who are just like, this works, so if it ain't broke, don't fix it, right?
Don't mess it up.
Don't mess it up. Don't get creative. Don't decide you have to go off in your own little thing. Don't do it, right? With this client, stick with what we got. And that worked really well for her, and, worked with her for a long time, and she was able to travel and, have a wonderful time, which she wouldn't have been able to do if we hadn't just found like the perfect thing.
It is interesting because I've had a number of clients probably in the last 3 or 4 weeks where one, I'm going to say, and it doesn't make me look good whatsoever, but here, go with me. She made a comment that, wow, my weight's finally the same as when I started with you 5 years ago, because weight was an issue that she wanted to lose weight. Okay, cool. But she had a bunch of things come up during that period of time that set her back, and she gained a lot of weight, and now she's lost it. But the way she said that, I looked at her, I said, well, that doesn't make me sound too good. And she laughed and she said, no, it's not you. It's me. I know that. And it was just one of those things. And I was like, you know what? Over the last 5 years with her, we've made a ton of progress, because obviously COVID was a big part of that too, obviously. But with other things that have flared up, I prevented her from having spinal fusion surgery. I prevented her from a number of things. And she's very stable now, where she says, yeah, it bothers me a little bit, but they're about to go on a huge safari in a couple of weeks. And she said, I never could have done that before. So again, it's taking those smaller steps and realizing, okay, we're going to solve the problems that we're having today. We're going to create the exercises that you need at this moment. And she was someone else who I can't belabor this point enough. Homework, people. The clients need to do things consistently. If they're only doing it 1 hour a week with you, it's not enough. So she was willing to do the homework. She was willing, and even 5 or 6 small kind exercises, not big deal. But it was enough for her that she felt good. She was able to make progressions. And then when she was here, I say, look, you do the boring stuff at home. We can have fun when you come in. And we are making progress. And we've made a lot of progress. She is so much stronger now. So much stronger. Even today, she was doing modified pull-ups and all this kind of stuff. And she was like, you could see, she was so excited that she was doing these things that were super challenging before. But again, we've progressed over this period of time. So it's not about making those gains in a short period of time. It's not bridal boot camp. It's not something that, we have 6 weeks to get you in, perfect shape.
Tip-top shape. Yeah.
Yeah. It's about, okay, we're going to go at the speed you need, because that's the important thing here. Not at my speed. My body's different than yours. When I train with my kids, I realize that every single time I'm holding, you're 17, man. You got testosterone up the wazoo. Okay, I can't keep up with you anymore. But I don't need to. That's their body. This is mine. I only got one, and I got to take care of it. So with the client in front of you, you really have to figure out what's going to be the right thing for them at that moment in time. And is it pushing a little faster, or is it taking your time and letting them breathe and letting their body really respond, and then make the progressions you need to.
One thing I wanted to say about home programs, especially for clients with chronic issues like this, like we're talking about, is sometimes this is going to sound a little funny, but sometimes it doesn't really matter what they're doing. It's the fact that they're doing something, right? It's like, yes, there can be the exercises, which can be doing whatever they're doing. But again, if they've been doing bridges and marching for 6 years, they're not getting a lot of additional benefit out of that, right? Presumably, like whatever, the body's accommodated.
Yeah.
But what they are getting is they're getting a check-in time, right? They're getting a pay attention to your body. Where is it today? What do I need to be aware of?
Mm-hmm.
You know, and it's really just, it's like a check-in. And a lot of, again, I think of this one client, Carol, if I'm using the name of Carol, that was the deal. Is she had this about 10-minute, 15-minute home morning program that was really just her chance to kind of check in. Where am I? What's hurting? What's not? What do I need to pay attention to? And that set her up just to be more conscious for the rest of the day of how to manage what her situation was that day. You know, do I need a little bit more of this? Do I need a little bit more of that? Do I need some rest? Do I need to be careful when I do this? Or can I actually push a little bit today? And a lot of times that's the role of those home programs. Again, not necessarily to push things a long way, but really to create that awareness, that presence, that check in every day. Where am I? Where's my body? What's my body doing? And how can I work with it?
Yeah, no, I completely agree. For a lot of our clients, they'll do nothing. If you let them.
Yeah, absolutely. Most will do nothing.
I've said this so many times.
So many times.
To classes of instructors, I say, remember something. We are the freaks. We're the ones who want to exercise, who love to exercise, who look forward to it every time we do it. We're the freaks. Our clients would love nothing more than to never step foot in a gym again, to never have to exercise, to never have to go for a walk for my health.
Yep.
They would love to do nothing more than never have to do that again in their life. And so for them to do any exercise, just getting them into a routine where they're doing something for their health, where they're moving their body through space in a way that is healthy, it's so important. So I completely agree. Sometimes let them do the same thing. If it is just bridges and leg lifts or simple exercises, you know what? If it's getting them to move, it's wonderful.
Exactly. Exactly.
Yeah.
So I think our lesson today is, right, patience. And really, I think that discussion, the initial discussion about really establishing the parasympathetic nervous system response and creating that trust. You know, I find with all my clients, the ones where it's worked for my chronic pain clients is where I've been able to establish that trust and that safety for them. And if I can get that to happen, then we can make progress. You know, I think of a couple of clients where no matter what I did, I could not get to that level of safety or trust with them. And those are the clients where I was stymied. I could not make progress because I couldn't find a way to get them into that more parasympathetic state. I just couldn't.
Yeah.
It was not a good match for them and me, and it just didn't work. So that's a key thing, right? And then slow progress, patience. Don't be afraid of repetition. Work on some kind of home program that's primarily kind of awareness based. And know that you are really, I think of all the teachers out there, and I think of you, and I think of all of your students and my students, you guys are the ones who do this. All right. Those of you who have this skill level and this subtle understanding of movement and how movement affects the body and how movement affects the nervous system, you have the ability to make this difference for people. Right? You're not trying to like have 4 sessions and get somebody better, like, you know, PTs often have to do, which I feel sorry for them because it sounds like an impossible task. And you're not going to be a push. Maybe some clients you are, but with these clients you're not. You have that ability because we have such complex understanding of the body and such wonderful movement environments. Yeah. So take that on as something that really can empower you and empower them to make change.
The only thing I'm going to add, 2 things that make a big difference. Your ears.
Mm-hmm.
Listen. I was just having a conversation about physicians with a client, and there are a lot of physicians out there where as soon as you are talking to them and telling them what's wrong, you can see that they're just waiting for you to stop talking so they can tell you what's wrong. They've
Exactly.
stopped listening. Take the time to really listen to what they're saying, because that is so important. Take the
Mm-hmm.
time, listen, take it in. Don't try and rush to judgment. Don't try and rush to a conclusion. Sometimes
Don't
there is
fix
no
it.
conclusion. Don't fix it.
Yep.
Listen.
Yep.
Just listen and say, okay, all right, let's work with that. Because you don't have to have an answer. There's not always an answer, but
Mm-mm.
take the time to listen. And that often will help establish that trust for a lot of people, because let's face it, so often nobody's listened to them anymore. So just to
Right.
have that,
Absolutely.
they're like, oh, this is someone who gets it, who understands. Okay, I feel like I could be like I'm safe. And I think that's a huge thing when it comes to clients. When they feel that safety, you've made a huge step in the right direction.
And one other little tiny thing about them talking is often they haven't been able to tell their story enough to get to some of the underlying issues.
Mm,
Right. I think of one client who was a low back client, a lot of other things I mentioned occasionally, but it wasn't until 3, 4 years after I've been working with her, and she was finally working with a therapist, that she realized all of her problems came from a bone marrow transplant that she
mm.
was the donor for when she was like 17 years old. And everything since then, she'd had pain in her hips and her low back. And it was like, but it took took years for her to actually uncover that. And when she did, she could make progress. But until she'd kind of processed that particular trauma for her, she didn't make any progress, no matter what we did or what anybody else did. So, that listening was the key thing, whether you're
Yeah.
doing it or somebody else is doing it.
Excellent. Well, I I think we got a lot accomplished today, and I think it's a topic that we all need to be reminded about sometimes, is to take our
Yeah.
time and not rush through things, because, sometimes things can't be rushed. The body's going to move when a body wants to move, and it's going to make
Yeah.
progress when it wants to make progress. And sometimes you just have to let it rather than force it.
Absolutely.
Well, thank you guys for joining us. It's been a wonderful hour to have you. We really appreciate every single one of you. And please do us a favor, hit that like and subscribe. We really appreciate it. If you want to get in touch with us, movingcombos@gmail.com is the easiest way. Also, check out our Instagram, Moving Combos. For Nora St. John, I'm Brian Ritchie. We'll see y'all next week.
Bye, guys.